went down and working with a lot of special forces, police, veterans, first responders. I used to be a trauma surgeon in County Hospital, where I got to see a lot of people. We used to call it night and junk club. It's all the same. Having people, losing people on the table is no different than being shot at in the street.
And that survey that he's saying to do, if you did that, you're going to be, you might be surprised at how high your score is, how much trauma you actually have. Yeah. And he's saying fight or flight. Those of us that are in this profession, we rely on our fight or flight daily. And it's a scary concept when someone says, oh, this resets your fight or flight. A lot of people will say, well, no, I need that. I need to be vigilant. However, it's amazing when you do get reset back to where a normal person is, how clear you can think and how different you look at situations. It doesn't get rid of your fight or flight. It just resets it. And they use this on active military special forces. When they come back from a tour, they give this to them to reset them. So it's nothing to be scared of that you're going to lose your edge.
Well, you're not frenetic, right? You're not looking everywhere. Think of a sniper. You don't want to be looking everywhere. You want to focus. So you want to be able to have target differentiation. Somebody comes at you, you want to decide the civilian, a good person, bad person, is it dangerous, whatever. You need to make a decision. But do you want to use the brain that my dog has, or do you want to have your neocortex, which makes good decisions? That's the bottom line.
Yes. So I met Dr. Lipov in 2021 through a good friend of ours named Mark Doyle. Mark works with veterans. He helps them reassimilate back into life, get a job, take care of themselves. And he has a connection with Dr. Lipov because some of the veterans have gone to Dr. Lipov for this treatment. So back in 2021, I was a commander of a unit of 700 officers across the city of Chicago. We dealt with the pandemic, we dealt with civil unrest, and it was a tough time, tough couple of years. Prior to that, part of my personal story is prior to that, in 2017, I was blindsided with a diagnosis of breast cancer. And a few months after, my best friend was just diagnosed with breast cancer as well. So we fought 3 years together until she passed. I luckily got through it, and I was really dealing with losing her. It was tough for me, and I had just gotten promoted to lieutenant, so I had a new job, and then civil unrest and the pandemic, and then got promoted again to commander, and now I have this large unit of young officers, very proactive officers. So they were getting into stuff every single day, whether it be a car accident, whether it be a critical incident, whether they were getting shot at or shooting somebody. It was a lot. And then in the summer of 2021, one of our young officers took his own life. And I stood in front of a roll call bigger than this, and I was looking at the faces of these officers, and I'm like, wow, I can do something. Like, what do we do? And then a couple weeks later, 3 of my officers performed a traffic stop, and my officer, Ella French, was murdered, shot in the face, died instantly. Her partner, Carlos, shot in the head, face, the shoulder, should have died, but miraculously he is still with us and thriving. And the third partner, Josh, he ended up shooting the offender. So it was a very critical incident. It hit the city very hard. This was a young female officer, not even 30 years old yet. So it really struck a chord with everybody across the city. And again, now I'm standing up in front of another roll call, and the faces I saw, it broke my heart because I didn't know what to do. I'm a mother, I'm compassionate, I can give you a hug, we can talk through this, but I was at a point where I didn't know what to say next. And somebody, a clinician in our department, in our professional counseling service, I'll say she urged me, maybe she made me go talk to a clinician, and which was great. I was going to wait until I handled everything with my unit, but she made me realize, no, you got to take care of yourself to take care of these officers. So I started working with the clinician, and she was great. She helped me a lot. However, I just couldn't get past it. There was something, and that's when I was introduced to Dr. Lipov, and I went in and got this shot. So it's I'm not scientific here, so basically it's a shot into your neck. It goes into a cluster of nerves, and it's super easy.
I don't feel that at all.
Yeah, Dr. Lipov.
I had mine done.
So I went in and got this shot. my best friend, Erin, she's here, Sergeant Lawson, she takes me, and we're there in the morning, there for a couple hours. I'm driving home and looking out the window, and I'm looking at the buildings of this beautiful city that it's like it was the first time I saw these buildings, and they were colorful, the sun was shining, there was no gray cloud. This weight was lifted off my shoulders, and I had not had this sense of calm in years, since well before cancer.
Were you able to take a deeper breath, you think?
Yes, yes.
Very calm.
Just simple things like that, where yes, I remember taking that breath, and it was actually like a cleansing breath. It wasn't just breathing to survive, and it really changed my life. After that, just sitting there at the table with my friend and my husband, I was kind of just looking at around at my house, thinking all the projects I wanted to get done, like cleaning up that room or putting the toys away there. That just kind of it was overwhelming. I'm looking, I'm like, okay, I have a plan. I'm going to go do that, and I'm going to tackle that. I'm going to tackle that project. I have these things at work. So I was able to employ all the tools that we all have inside of us to deal with things. I was able to employ those tools. And again, it changed my life, changed my family's life. And I think it's important. We're here to talk about this because it's important to know that there are these alternative treatments out there to help us. There are resources across the world. And we'll put more information in the app. I'll put more information in the app about which countries do have this available, because the doctor has trained doctors from